Good afternoon, everyone. This is County Executive Pat Ryan. Thank you for joining us on this beautiful fall day. It's actually been a little while since I've done one of these updates because we had our budget address on Thursday, so it's been a week since our last update. I hope everybody has been doing well and staying healthy and safe and hopefully enjoying some awesome fall weather. I know we definitely did that this weekend. Today we are going to talk about just what's happening with COVID, and I'll just I'll start off by sharing, as I've always promised, we'll give you the data and we'll give you the facts one way or the other. Less good news in terms of where we're at with COVID. In the last 96-hour period, we've had the worst new infection rate. The worst we've had since August. So unfortunately, we are seeing right now a relatively small, but an increase in new COVID cases that is concerning to us. So I'm going to talk a little bit more about where we're at with that, how and why we kind of see that happening, and more importantly, what we can all do to make sure that we continue to keep that under control and keep moving in a positive direction. Again, I will always use the data and the public health expertise and the science to shape what's happening and how we're going to react. So starting by the numbers, as we always do, our total case number is 2,330, and we are just shy of 100,000 tests completed since the beginning of COVID, 99,214 to be exact. Our active case number, which we'll talk more about in a minute, is up to 155, which is a little bit high compared to the norm over the last month or two. Thankfully, our fatality numbers have held at 95 now for several weeks, and the recovered number keeps going up, which of course is good news at 2,080 now recovered from COVID. In terms of the hospitalizations and how we're looking there, this number is also still very much within the historic norm. We have 4 individuals hospitalized right now. You can see a very, very slight uptick there, but we're really talking about consistently being somewhere between 0 and 4 individuals hospitalized. We were up to 6 for about a 24-hour period, but we're now at 4. And holding pretty steady at that number, but that's of course another thing that we'll watch closely. The active case number, you can see the trend on the graph here. We're at 155 right now for active cases, and that has stayed steady, but we're up about a net 30 cases over the last few days, so that is up slightly from a relatively low period. Where we're really seeing, though, the most concerning trend is in the metric that I always say is the one we're watching most closely, which is the number of new positive cases compared to those tested each day. So I do want to share, I'll share those numbers with you. As I said at the top line, we always try to normalize this over a few days. So over a 4-day, 96-hour period, we have a new infection rate of 1.34%. That is the worst we've had since, you can see it right there on the graph, going back to August, when we had a spike due to state prison inmate numbers. So this is anomalous in a bad way to see that number consistently now up over 1% for a several-day period. To give you a sense of the raw numbers, though, that means we've tested 2,611 tested in that period, and 35 have been positive. The total numbers are relatively low still, thankfully, but we very much are concerned by that over 1% new infection rate consistently. If you zoom out, of course, to the state, we are in much better shape than I'm sure you've now heard from the governor and other leaders about a few of the pockets, the sort of top 10 zip codes, if you will, predominantly in New York City, as well as Orange and Rockland counties, where we've seen upwards of approaching double digits of new infection rates, 10-12% new infection rates. So we are well below that. But I always want to raise the flag when we start to see ourselves creeping up. And really, what this is to me, and I think needs to be to all of us, is just a reminder that we absolutely have to stay vigilant when we see especially the numbers go up in other parts of New York State and other parts of New York State that are pretty interconnected with our region in terms of transit patterns and even family connections. That makes it even more serious that we maintain that vigilance. And again, it's pretty simple, and I'll say this probably 10 times today alone. These masks are really, all the science every day is showing more and more that masks are the most effective way to slow the spread, and a relatively easy and painless way to do so. So I just want to remind folks that there is a challenge in front of us, but there's also a solution in front of us, and the solution is us each doing our part, as we've been doing for the most part, to keep these numbers down. I do want to talk a little. I'll talk a little bit more about what's driving this in a moment. Hospital and treatment capacity, as I said, we are at 4 COVID-19 hospitalized patients right now. That is still within the norms, and we have more than adequate capacity if needed going forward. So I want to talk a little bit about, in the vein of what we can do proactively now, and what we are doing proactively now in anticipation of any increase as we head into the fall now and eventually into the winter. Also, as we now have almost all of our school districts are back in hybrid mode, with more and more students coming into the buildings in every district except for Kingston and New Paltz. So all the other districts do have some form of hybrid learning, with some in-person happening, which also raises the risk profile. So I'm just going to talk about really plans we've had in place, our rapid response plans, and just make sure everyone understands that these are still very much happening and working, so that as we see the numbers going up, we can maintain awareness and ultimately slow and control the spread. So our overarching rapid response plan as it relates to COVID, I mean, this is something we're really behind the scenes doing every single day, and there are 5 key pieces to that. Number 1 is identifying new cases. That's about our testing capacity. We still very much have a robust testing capacity. We're approaching 100,000 tested total, and we can do hundreds, if not into the thousands, of tests each day. We also are pursuing and looking to scale up rapid testing. We don't quite have it ready to go yet, but we're sourcing and working on a plan to that end to be ready hopefully in the next few weeks there. The second step is investigating with contact tracing. This, again, is happening every day, and as cases ramp up, becomes more and more important. Then, of course, we'll isolate through quarantining and maintaining separation from those that are positive or possibly positive. Always communicating throughout, and equally importantly, enforcing the rules. And every day we still are receiving these pause complaints about where a small number of folks at businesses or grocery stores or wherever the case may be not following the pause guidelines. We are very much still tracking that and enforcing that consistently. So this rapid response plan really has been in place for the last 4 or 5 months. And this is what makes me feel confident, ultimately, that if and when we do see clusters emerge, we are able to quickly detect them and act on them. And the key is to contain those clusters so we don't get back into a situation like we were in April and May of community spread. That is really our overarching goal, and I feel very confident that we can do that based on what we've learned and all the things that we've put in place. Now, when it comes to schools, I want to hit on that again as well. We also have a school-specific rapid response plan, and we rolled this out a few months ago when online learning started. But obviously now with students and teachers coming back into the building, this is even more important. At a high level, just essentially the takeaway for everyone is that we've taken those principles of the 5 components of rapid response, but really worked and put the resources towards a specific plan to support all 9 of our school districts that are either fully in or partially in Ulster County. In our health department, we have one individual exclusively working in partnership with the school districts. They're in daily conversation with every single district and their medical staff and their leadership. We have a testing and screening procedures in place that our health department have worked through with the schools. And ultimately, if we have any positive cases, which we have not had yet, if we did, we are ready to go to send our rapid response team actually to those schools to be on site and make sure that we're handling that appropriately, and that as a county, through our health department and our emergency management department, that we are there as a resource and knowledge, really experts to help the school districts through that situation. The other thing that we've done that's important for the schools is we have proactively distributed 30,000 masks to all the districts, so that every student, teacher, and faculty member will have at least one cloth disposable mask as they do get back into buildings, so we can, again, make sure that no one has an excuse not to have a mask, because we know that that is the most effective way to slow the spread, at least until we have a vaccine, which will, we don't know when, but will hopefully be soon. So really, again, I just want to reiterate that while we are seeing the numbers go up, I do feel that we as a county and as a community are ready to respond if they go up further. But most importantly, we can control our destiny when it comes to these numbers. These are not just out of the sky, imposed from somewhere else. This is a direct reflection of how each of us, each individual, each business, each organization and school, how seriously we take this and how we follow through on those guidelines. So please, please, please continue to wear masks, maintain social distancing, and wash your hands and use hand sanitizer. Those big three preventive steps, I'm sure at this point are getting old, and we're constantly repeating them, but we're doing that for a reason, because we know that they work, and increasingly all the health experts are validating that they work. In fact, I'm sure many of you saw a few weeks ago, the CDC director in testifying to Congress said, he held up his mask and said, I believe that this mask is even potentially more effective than a vaccine at slowing the spread. So we know how to do this. We've done it before as a community. And really, my main goal today is to remind everyone of that, remind us that this is the moment to keep that vigilance up. The last thing I do want to say is just in terms of the patterns of where we are seeing the numbers go up. It's a pretty consistent pattern that there are a few points of great risk. And these are not new. These are ones that we've seen already when we did see some clusters pop up. So number one, any setting where we have groups of individuals living together, whether that's a senior facility, nursing home, a group home for those with developmental disabilities, any setting where you have larger numbers of people that are living together, may congregate together for meals, and have staff coming in and out. Those are points of risk, and that's why we have been really focused in working with each of those entities. But some of the numbers, increasing numbers, we have seen in those facilities. The other consistent place that we've seen are like parties and gatherings. One of our current clusters revolves around a series of folks who were gathered for parties, predominantly outdoors, but we believe there was some indoors and a lot of close contact and likely not mask wearing. So those gathering events, as much as we all want to desperately get together, just know that they do present greater risk and that we need to maintain extra caution if and when we're doing those, and really stick to the limits on size and distancing where possible. Those really are the two greatest points of risk. And of course, schools, we're watching closely, and I talked about our plan there, but that's another place where we know there's an increased risk profile that we're working very closely to address that and mitigate that risk. So I know that was a lot of not necessarily bad news, but news that's concerning, and news that I hope prompts us to feel a renewed sense of needing to keep our guard up, but also feeling empowered to ourselves and with our families and our friends remind each other collectively that we are very much still in this, but that we're in it together, and that if we each recognize that, we can continue to hopefully get these numbers back down below 1%, continue to keep each other safe and healthy. And a key part of that, as we wrap up, of course, are our incredible frontline workers that have gotten us through the worst of this, hopefully, back in the spring and in the summer, and are very much still on the front lines in many ways, keeping us safe. And so, as always, I'll end by thanking them, of course, our healthcare workers, food and grocery store workers, public transit, teachers that have had so much pressure on them, law enforcement, delivery and mail carriers, our journalists, first responders, and really so many others that are still putting themselves at some risk to make sure we can get done what we need, get those essential things done to keep our economy running, keep our society going. So we're going to continue to count on each of you as well, and thank you for what you've done to get us to this point. So that is the update for today. I know based on how we've responded, and at this point, I feel like I've seen it up close and personal firsthand, how our community can rally and how we did rally. I know that with this new information and with things where they are, we are going to come together and use this as a way to get the numbers back down and keep moving forward safely. At any point, if you or someone you know needs help with food, housing, mental health services, addiction services, and anything that you're struggling with, you can always reach out to us at our Recovery Service Center. Standing by, we have a great team that can help, 845-443-8888, or at our website or via email, which you can see on the screen there. As always, I want to thank our team that makes this happen, from the Radio Kingston team to our translators and interpreters, Diane, and I think, is Manuel here? Manuel as well. Oh, there he is. Thank you for helping us keep the public informed and safe. And to each of you for tuning in, thank you. We will see you on Thursday at 2 p.m. And in the meantime, stay safe and healthy and resilient, and talk to you soon.